And she is my go-to person for my patients because I feel like the level of thought she gives to their management is exceptional. And there are many good people in our community, but she's the rising star as far as I'm concerned. And I mean that in the sense of the information at her fingertips, the thoughtfulness with which she then uses to apply it to patients, and the quality of the patient outcomes. So with that, Dr. Stuller.
I could have been in psychosis going, Dr. Ross. Hi, everyone. I'm Dr. Liz Stuller. I am a board-certified adult and addiction psychiatrist. The real truth is I am the youngest of 6 children, which was my training in psychiatry. I graduated from LSU, which is a big SEC school, for those of you who are football fans, which was my training in addictions. I managed to escape unscathed with any addiction issues, but Louisiana, as you know, with Mardi Gras and our French culture, and for those of you who have traveled to New Orleans and out safely, you will know that it's very tempting down there. They call it Sin City for a reason. To give you an idea of my typical work week and a little background, I did my training at Temple University in North Philadelphia. And North Philadelphia has one of the biggest heroin cocaine areas, and on top of that, one of the busiest crisis centers. So if you were naked in a PCP psychosis running down North Broad at 3 a.m., you were coming to our emergency room. So I got excellent training there. And then I did an addiction fellowship at University of Maryland. And as you know, also in Baltimore, we certainly have our share of cocaine and heroin and hardcore inner city folks that most of our patients are very complex. They're usually on at least 5 substances of abuse. A typical day might be someone coming in with 8 bags of IV heroin, half a fifth to a fifth of vodka, a gram of marijuana with a pack of cigarettes and half a pint, and HIV and hepatitis C, and about 5 other medical medications for hepatitis C or hypertension or diabetes. So I got really good training with dealing with very complex patients. So during the week right now, on Monday mornings, I teach the medicine residents at Union Memorial Hospital by their request, which was interesting. At the end of their residency, we have surveys, and the medicine resident said, you know what, we need help in communicating to our patients or understanding how do you ask a patient, are you doing raw or scrambled heroin? So they wanted additional help in communicating to the inner city populations. And it's been a great experience there. On Monday afternoons, Tuesdays, and Wednesdays, I have a private practice in Catonsville. And then on Thursdays and Fridays, I'm at the Amen Clinic in Reston, Virginia, which is where we do brain SPECT imaging. And I'll show you a little bit of that today, which we use as a diagnostic tool. And I'll show you today that when you do neurotransmitter testing and imaging, and you put those two together with a good clinical history, you have literally a blueprint and a chemical blueprint on how to get people balanced out. So it's a lot of fun. So I will, without further ado, I'll kind of jump in. So ASAM is the American Society of Addiction Medicine, and they recently changed their definition of medicine to include that this is traditionally a problems with, as they call it, a chronic disease model, but more importantly, they're beginning to identify for the first time problems with the circuitry. I'll be talking a little bit about this neurotransmitter testing, which is basically I get a spit and a pee sample from my patient, and I can tell you a lot of information from that just by looking at that chemical specimen. And I'll go over a couple cases with you to show you what it looks like when we apply it. So as you know, addiction is a primary chronic disease of the brain, but for the first time they're talking about circuitry. The more I got into addiction, the more I began to understand that you have to understand all of these little neural networks that are connected between your prefrontal cortex, your cerebellum, your glutamate pathways, your norepinephrine, your epinephrine. It gets quite complex, but as you begin to master that and understand the dysfunction or the disconnects, you will understand why people choose the medications or the substances that they choose to abuse. it's interesting when I have young people come in, I often say, one of the funny things that I say is most people don't want to come in and voluntarily tell you that they're doing heroin or coke or crack. So I always say, if you could go to heaven and use 3 drugs for eternity without getting arrested, going into debt, paying off your grandmother, what 3 drugs would you use? And they usually will volunteer those 3 drugs. But I say, what are the positive benefits of your drugs of choice? So people that are using cocaine or methamphetamine, they usually have very quiet brains and they're trying to stimulate themselves, versus people that are in inflammatory states have very hot brains and they're choosing things like heroin or marijuana to kind of calm things down. So a person's drug of choice gives us some immediate ideas as to what's going on the inside of the brain. Now, as you know, and this is important, how many of you guys have teenagers? No teenager, okay.
You gotta ask how many have that.
How many of you guys have been bothered by a teenager? Excellent, all right. So, for all of you to understand, the front part of your brain, the prefrontal cortex, is the boss of your brain, and it guides your executive decision making. This grows in your brain until you are 25 years old. Okay, so you're the boss of your kids until they turn 25. I also try to encourage parents to do everything they can until a kid is 25, when they have a full deck and it's fair game. Now, the prefrontal cortex is outlined here in red. Again, this is the front part of the brain. This is actually an Allstate ad. For those of you that can't see it from there, it says, why do most 16-year-olds drive like they're missing a part of their brain? It's because they are. Again, this fills in until you're 25 years old, and that's actually when driving rates go down, insurance rates, because they're less likely to run a yellow light or to get into trouble. There's something called the swoops test, for those of you that are familiar with psychology, where they might write red on a white card and blue, and they'll say, what color is this? Before 25, you'll say blue, red. You'll jump at the answer. After 25, you might say, Dr. Stuller, could you just clarify your question? Are you asking what color? What does the color mean? What does the word say? But until you're 25, you can't quite assimilate that information. Now, sadly, the worst part of my job happens when people get into drug problems, and I have to talk to a parent after the death of their child. As you can see here, this is a brain that has been smoking cannabis. So do you see here where you've got decreased activity?
Phones off. Phones off. Please, have the courtesy.
That's okay. I can answer it for you. I used to do that to the teenagers in my office, and I go, Steve's tied up right now, and I think he likes it, but...
That's good.
So, all right, so back to the more serious...
You want the lights down?
Yep, that might be helpful. There we go. Now, so do you see that when a kid has not a lot of prefrontal cortex or still developing, let's say they're 16 and they're smoking marijuana, do you see how you get decreased blood flow to the front part of the brain? So now I don't want to say you make dumb dumber, but in a way you make dumb dumber. You also decrease blood flow to your temporal lobes, and as a result, people will have trouble with memory and information processing. Now, I'm from Louisiana. This is a pretty big truck. I'm pretty sure it's a double cab truck, if there's any guys in the audience, or gals for that matter, and it's reinforced with steel up here. I worked as a paramedic before I went to medical school, and I can tell you that to bend a truck like that takes a lot of force. And I'm sure the parents who bought this kid his truck probably felt pretty confident that he'd be pretty well protected in that truck. So we used to say as paramedics that we have a job because people do stupid things, and certainly when you're using drugs and driving, unfortunately we see these disastrous consequences, but it doesn't have to be that way. The sooner I can catch a kid, I've had a kid come in last week who was 17, and I said, thank God you're here at 17, because his brain looked like this, and he didn't think smoking marijuana was a problem, because I said, had I met you at 45, you'd have probably had 2 divorces and a couple incarcerations and a few speeding tickets and maybe a bankruptcy. So the sooner we can catch people, the better on treating their conditions. Now, we don't want to go into the hard details, but these are the circuitries we're talking about. In your brain, you have a particular area called the locus coeruleus, which makes norepinephrine. Normally, if you're at age 20, your locus coeruleus should look this big. I'm just exaggerating. And then when you're 50, it should look this bad, or this big. When you've been under a lot of stress, by the time you're 50, this looks like a little tiny gumball. So you can actually burn out your locus coeruleus or your sympathetic nervous system early, and this often not only leads to craving stimulant drugs, but if someone's been using a lot of stimulants, they've been dumping all of their norepinephrine and dopamine. Of interest, there's some concern that our copious use of stimulants in psychiatry and other specialties as well may be causing early Parkinson's disease because we're depleting dopamine. So Ritalin's been out for about 50 years now, and I'll show you that if you're going to give a medication like Ritalin or Adderall, you need to also be repleting with something like L-tyrosine. Replete means to give back. So you make norepinephrine and dopamine, and you can spin it, but you should be doing both in the process. Now, when we look at addiction, there's lots of things that can cause relapse. I call it the anatomy of a relapse. Is it a drug or reward-triggered relapse? Is it a cue-triggered relapse? Or is it a stress-triggered relapse? University of Pennsylvania did an interesting study. There's a saying in AA and NA, stay away from slippery people, places, or things. Visual identification can set you off. University of Pennsylvania did an experiment where they would put people in the scanner in a functional MRI, and they'd take a picture of or they'd show you a picture of a hummingbird. So most people, that's a neutral stimuli, nothing would happen. Then they would actually let the patient inject heroin or cocaine in the functional MRI machine, and guess what would happen? Those dopamine pathways would light up. A year later, when they were clean or sober, they'd go back to the machine, they'd show them the hummingbird picture, nothing exciting happened, and then they would show them just pictures of paraphernalia, crack smoke in a bottle, a pipe with smoke in it, a needle with some heroin next to it, and guess what would happen? The brain would light up. And often I see people, and detox rehabs are very expensive, sometimes up to the tune of $25,000 or $30,000 a month. So people behave while they're inpatient, but then I had one patient, as soon as he'd see an ABC liquor store, he'd find himself inside the next day or that day. So again, visually, you must be very careful. And using the neuroscience research and the neurotransmitter testing, we can kind of predict who's going to get into trouble. You're going to be hearing a lot more about glutamate in the next 10 years, as well as inflammatory processes. Glutamate is really important for reward pathways between the prefrontal cortex and the circuitry that runs through the brain. We're going to talk a little bit, too, about motivation and reinforcement through these particular brain structures and what the neurotransmitters look like as you line it up next to that area. Now, here you can see, remember the prefrontal cortex, you have circuitry that involves dopamine and glutamate and often norepinephrine. The nucleus accumbens is a big center as well as the ventral tegmental area. This is like addiction central in the middle of your brain. So when you get increased dopamine signaling, so if all of us did $200 of inner city Baltimore crack cocaine, dopamine would shoot up. First, we would feel good, because dopamine is a reward molecule. Then we would get pleasantly paranoid, as I like to say, like, you think mom knows we're up here smoking pot? Then maybe a few minutes later, people might get unpleasantly paranoid, or the police coming. And then if dopamine gets really high, you can become psychotic. You can hear things or see things. So you can have something called a substance-induced psychosis, or you can actually... some people that have schizophrenia just have too much dopamine in their brain and they can't metabolize it out quickly. And we feel that it's a genetic issue, but we're still working on that problem. We have so much stress now in our lives. Dr. Ross and I recently attended a seminar with Dr. Andrew Weil, and he said that he showed his daughter two of his favorite movies. He didn't name the movie, but it was like Gone with the Wind or another movie. And she said, Dad, these shows are boring. And it took him aback for a minute, but he realized with these younger whippersnappers, as I like to say, information texting, if you even look at a TV show now, think how quickly they flip the scenes versus Gone with the Wind, where you might have a delayed scene that might last a whole minute, where people are actually talking to each other. So what's happening is you're constantly dumping out dopamine and norepinephrine, and this includes kids that, if I call them the vampires. For many teenagers today, you may be seeing this vampire syndrome, I call it, where you can't get them out of the house in the morning, you can't get them up. A perfect day for them is they would get up at noon, 1 or 2 p.m., and play video games or run around till 5 a.m. But at the end of the day, they're shining cell phones into their eyes, or they're playing on their pads, or they've got big screen TVs, and they're just constantly dumping dopamine and norepinephrine, and we see this early burnout happening. And again, we worry in particular about this norepinephrine A2 nucleus and this corticotrophin releasing factor, which is the stress hormone. Now, the biggest complaint we get from colleagues in psychiatry is that psychiatry has never been scientific enough. I always call it voodoo psychiatry. You go to the psychiatrist, how do they know what medication you need other than a clinical history? Now we've got tools coming our way, and this includes looking at biomarkers in the spit and the urine and the blood, as well as looking at biomarkers and structural differences in functional MRIs and CTs and SPECT scans. What about for addiction? So these names will become more familiar to you as we work through this. So some of the names, serotonin is important for depression, epinephrine is important for energy, GABA is the big breaks in your brain. It's a very calming neurotransmitter. Alcohol metabolizes into GABA. Progesterone metabolizes into GABA. Norepinephrine, again, this is kind of like a go type of neurotransmitter. Dopamine, we just talked about, very important in reward pathways. Glutamate, often you need some glutamate for memory, but if glutamate gets too high, glutamate is like a high voltage jack. And if glutamate gets high from an inflammation of some sort, you get neuroexcitotoxicity, where the neurons blow up. It's just like you're surging. Has anyone seen a power line surge and then you blow the transformer? That's too much glutamate. So you can actually destroy neurons in the brain if you get too much of this surge. Now, this would be an example of what these neurotransmitter tests that I'm talking about. So you could simply pee in a tube for me. I send it off. Most insurances cover it. And then in 2 weeks, I would have information that would tell me several things. For example, serotonin. If serotonin is low, you will have depression, anxiety, sleep disruption. If serotonin is too high, you might have road rage, or for women, they might get disinhibited. Of interest, if people are going through a divorce, and I gave both the husband and the wife Prozac, they come back a few weeks later and they go, oh, we feel much better. And then but we still need some more Prozac. So I upped the dose, they would both come back, and the husband would say, Dr. Stuller, I had my first episode of road rage. What happened? I've never had road rage before. It's because serotonin got too high. And the woman says, I was at a stoplight and this guy winked me, and then I flashed my breast. I've never done anything like that. What the hell is going on? What happens is if you turn up serotonin and dopamine are on a seesaw. As you push serotonin up, you drop dopamine in your prefrontal cortex, and you will get disinhibited. A quick little point on this, every night when you go to a restaurant, what's the first thing they give you usually? Bread. Where's the bread? I want the bread. So you get the bread, and what is bread often makes serotonin very quickly. So now we've dropped dopamine in your prefrontal cortex, so your guard is down. Then what's the next thing they say? Would you like a drink? Right? Now you're vulnerable for a drink. And then after dinner, what do they chase you down with? Chocolate or coffee, because now they want to reboot you so you can clear up enough to pay the bill. Okay, it's all brain chemistry. It's very interesting. Now, this 5-HIAA, serotonin metabolizes into 5-HIAA via the MAO enzyme. Why is this important? If you had low serotonin and really high 5-HIAA, think of MAO as your trash man. As fast as you make serotonin, the trash man takes it to the dump. So that person's likely going to have to constantly be given or repleted with serotonin. If your serotonin is really, really high and you've got low 5-HIAA, it means that your trash man is lazy and he's letting serotonin trash accumulate in your brain, and as a result, you're going to be more susceptible to road rage or disinhibition. So we have to look at what they call, this would be the substrate and this is the metabolite. So we look to see in a sophisticated sort of way, is there an enzyme problem that's causing your excess or your deficiency? GABA is the big brakes of your brain. When people come in with low GABA, and taurine is not on this list, and low taurine, they will almost always endorse symptoms of panic, anxiety, or arrhythmias. You guys see, a lot of times my patients walk in drinking these big energy drinks. So energy drinks have between probably 80 and 400 milligrams of adrenaline. But if you're taking 80 or 40 milligrams of adrenaline, you should be having tachycardia, your heart should race, you should be having hypertension, blood pressure goes up, and actually you should be having a seizure. But guess what happens? They load those drinks with taurine. Taurine is like pouring lidocaine on the heart. So you can take the cardiac adrenal hit. Does that make sense? It's kind of like a modern day speedball. So if you have low GABA and taurine at baseline, you might be craving these drinks because you just, you're looking for some surge, but more importantly, you're not going to handle the drink very well because you don't have any braking ability with the GABA. Does that make sense? And sometimes people can have low normal GABA, and what I say is you have thin brake pads. It's like you could drive to work and back with thin brake pads, but if you have to throw on the brakes for a major life event, a divorce, a job loss, a death of the dog, or there's a good chance you might crash. So GABA needs to be just right. Glycine is also an important calming neurotransmitter, and it lives in your brain and your spinal cord. Glutamate, again, if glutamate is really, really high, we're going to see neuroexcitotoxicity. Histamine is very important. Histamine is an immunological marker. So if histamine is high and we see an elevation of the 3 Gs, as we call it, histamine's up, glutamate's up, so you've got something driving inflammation. And then GABA and glycine shoot up because we're trying to compensate, we call it a compensatory response, to cool off this surge of inflammation-driven excess in the glutamate and the histamine. PEA, phenylethylamine, is the same excitatory that's in dark chocolate, but it also lives in your brain. So sometimes a family or a parent will bring me a kid saying, I think my kid has attention deficit. Norepinephrine and dopamine levels are okay, but what they're missing is phenylethylamine, which is very important for concentration and attention. Does that make sense? Now, dopamine, again, is very important. Low dopamine, you're going to have trouble with people that have Parkinson's have low dopamine. You get a flat face, you slow down. Dopamine is also very important for movement. If you have a burned out drug addict who's in particular done a lot of heroin or a lot of cocaine, often at 35, they have really low levels of dopamine and nothing excites them anymore. Of interest, we're having a lot of problems right now with internet porn. I read an interesting, as an addiction, I read an interesting article at the hairdresser the other day in a GQ magazine. And a guy said that he had worked like for the VA for 10 years, and so he's probably in his 30s, but they blocked those computers, so you can't play online. But then he got a shiny new laptop, and he was shocked that within 10 years, internet porn had just exploded, and they had all kinds of craziness. But what happens again when people are doing a lot of internet porn, they're dumping all of this dopamine, and then often it's very hard to get a rise out of them after that, no pun intended, because normal sex just doesn't seem very exciting. I had a father-son come in, and the father said, son, he said, you know, if they were both doing internet porn, so they were both on the hot seat, but he said, if you keep watching all this kinky, crazy stuff, the more you do this, it just gets so out of hand that normal relational sex is going to be really hard to come back to. So it's sometimes a box you can't, you can get out of the box, but it may be hard to get back in. Norepinephrine and epinephrine are very important energy type of neurotransmitters, and they get you up and running. Low norepinephrine and epinephrine can look like problems with concentration and attention. Now, we've had some recent scientific advances that are helping us quite a bit in understanding how these neurotransmitter systems play a key role in the expression of not only substance abuse, but general psychiatric symptoms as well. So, for example, when we look at this neurotransmitter testing, it tells me what type of therapy you may need. I can kind of identify who's at high risk for relapse. I can tell you who's probably going to need a more aggressive or extended therapy. And we're going to use this also as a tool to recheck how you're coming along in a few months to make sure that your levels are coming up to snuff. Now, this is a soldier that I treated. Do you see how everything is really low? This guy had done like 8 years of these tours back and forth to Iraq and Afghanistan, multiple bronze stars for valor in the field. And now it was bad enough that he was burned out. Now the United States has hired him to be an arms dealer. So now he's running all over the world selling arms. Now psychiatrically, that's probably somewhat of a conflict for him because you're defending, but now you're selling weapons that are going to hurt people. And so I'm sure that that was problematic for him. The only reason he came in to get his brain scanned is his mother was very worried about his drinking. And I'm sure he was drinking to kind of ease the pain. But do you see that he's absolutely depleted across the board? This is like a chronic inflammation where you just, as we say in Louisiana, you don't have pecan left to give. You're just out of gas. And just about anything you do for this patient will make them feel better. This pattern makes people at extremely high risk for suicide. An interesting number today, do you know what the number of suicides is today for all active and inactive military personnel? It's 18 a day.
Wow.
Okay. And this is a shocking statistic, but every morning in Baltimore, when you turn on the TV and you see a homicide on TV, on average, every time you see a homicide on TV, there will be 2 suicides in that same day.
Wow.
It's a little understood number. Usually it runs about 30,000 suicides a year to about 15,000 homicides, give or take a few thousand. So it certainly raises your awareness of people who are at risk for suicide. Now, this also helps me pick your medications. If you have a good personality as a psychiatrist and you screw up the patient's meds the first time, they may come back to you a couple more times just because they had fun with you the first time. But if you have a bad personality and you mess up the meds the first time, you may never see that patient again. So instead of experimenting on you, I can actually do a neurotransmitter test. So let's say that you come into me and you're complaining of depression and anxiety and low energy. Do you see here that if someone has low norepinephrine, dopamine, and serotonin, I could easily give them an SNRI, things like Cymbalta or Pristiq or Effexor, and I could also give them amino acid substrates like 5-HTP, which makes serotonin, or L-tyrosine, which makes norepinephrine and dopamine. And their likely drug of choice, if we don't treat them, is probably going to be cocaine and methamphetamine because it will surge norepinephrine, dopamine, and serotonin. So it's very important that when people have deficits that you actually treat those patients. Now, if someone comes in and they have high norepinephrine and dopamine and low serotonin, if I gave that same patient a Cymbalta or Effexor or Pristiq, which has norepinephrine, dopamine, and serotonin, there's a good chance that that patient will, they'll call me up going, Dr. Stuller, I feel like I'm jumping out of my skin, because they already have high norepinephrine and dopamine, and when I throw more norepinephrine and dopamine on, we're actually revving them up more and making them anxious. Does that make sense? So wouldn't you like it if we had a way to figure out, which we do now, we don't make medication errors as often with this technology. I would predict that in the next 10 years, we'll actually be able to do saliva samples, and I'm going to know that you might be a Paxil responder, you might be a Lexapro responder. Often I ask if someone in your family is doing well on Lexapro or 5-HTP or L-tryptophan, there's a good chance that you may also be a responder. So there is a genetic predisposition sometimes, which is helpful in selecting medications without error. Now, I've learned from using this technology how to use a combination of both natural supplements When I first started doing this, it created kind of a conflict for me. Tell you a little story. I had a good friend, and they said, he's an addictionologist. He said, listen, I really need a favor from you. He goes, could you take on my mother-in-law? So I was like, okay. So I got her up and running. Everything was going well. And she lived in another state. Suddenly I get a phone call in the middle of the night, and she's in a delirium, and she's in another state, and when they're sending her to Union Memorial Hospital, and I have her on all these pharmaceuticals and supplements, and I'm like, holy crap. She's going to get up to the unit, and my colleagues are going to do Cabanase, 5-HTP, L-tryptophan. What the hell are you doing? What is that? You know, because a lot of our colleagues don't know anything about using natural amino acid supplements. Now, of course, when she gets to the unit, the first thing they want to do is give her ECT and shock her. So I called my colleagues, like, whatever you do, don't let them shock her, and don't shock a toxic brain, because I knew that she had inflammation. Now, I'm not against ECT. There's certainly a time and a place where ECT is very important. It has saved pregnant women's lives where they're psychotic and they need ECT to get out of it. So I'm not saying that I'm not against it. There's just a time and a place for it that's very important. As a result, trying to bring in a balance of the combination of these therapies is important. So when I first started doing this, parents would come to me with their 7-year-old, and they'd say, okay, the other doctor diagnosed my son with ADD, and I'd say, okay, I agree that your son has ADD. And so I'd say, we can give him Adderall or Vyvanse, and then I'd go, but I said, actually, I can also start with checking for his diet to see if he has inflammation, because that can erroneously make all these neurotransmitters go up. And by the way, I need to check his eyes to see if his attention deficit is a problem. Later, I could also scan his brain to see if he truly had an attention deficit. And thirdly, I'd say, looking at the neurotransmitter testing, he's low in norepinephrine and dopamine. I could give him Adderall, but I prefer to start with some L-tyrosine, which would give norepinephrine and dopamine as a natural stimulant, rather than giving him a medication. And the parents would be like, well, of course I want to go natural. Why doesn't everyone go? Why isn't this information out there? So I was like, okay. So I'm trying to get the word out to help other families and parents use a natural approach. Often the natural supplements trump a lot of our psychiatric medications, and sometimes you need a combination of both. The one time where medications absolutely trump in psychiatry is dopamine regulation. Dopamine has 5 different highways through the brain, and people have different numbers of gas stations on those highways or receptors. So dopamine regulation is very tricky. If someone has high dopamine and they're either pleasantly psychotic, as I like to say, or psychotic, and they have low serotonin, I can push the serotonin up to try to get their dopamine down naturally to get them out of a psychosis. But if serotonin's here and dopamine is here, I have to use an antipsychotic to get that dopamine down quickly, or people can get into trouble with a psychotic episode. So again, we'll talk a little bit about alcohol, benzos. Sedative hypnotics are things like Lunesta or Ambien problems. So when you have low GABA and taurine, we talked about this, you're going to crave sedating medications like alcohol or benzos. Of interest, I get a lot of 50-year-old women that come in with their first DUI, and I go, did you go to LSU? They're like, no. This drinking just started in the last 2 years. I'm a burned out soccer mom. I started having a glass or 2 of wine at dinner, and then it turned into a half a bottle, then a bottle, and then I accidentally got caught. And what's happening is no one's bothered to look at the poor woman's hormones. So as we age, if progesterone gets low, remember progesterone metabolizes into GABA. So if a woman has low GABA, guess what? She's going to be looking for something sedating, especially if she's got teenagers at home and she's busy. She's going to be pretty stressed out. Also, people that use a lot of drugs for a long time, methamphetamine is a huge problem. We don't see it that much right here on the East Coast. It's all over the West. It's come through the rural America. It's coming up through Virginia and a little bit down from New York. And at first, I just thought our drug dealers were doing a really good job protecting cocaine out of these areas. But the truth is that if you cook meth, it creates a smell. And so you kind of need to be out someplace where people, so if you're living in a row house of, 20 neighbors in Baltimore, recently they had a hotel a bust, so people smelled people cooking it, and so that's why we don't see it as often here. And I can tell you, methamphetamine brains look awful. There's lots of holes in the brain. But you actually will reduce your tyrosine hydroxylase levels, so therefore you don't make as much norepinephrine and dopamine. You increase glutamate, which again can cause neurotoxicity and cell death, and you decrease your dopamine transporter density, which gets people into trouble. The less dopamine you have, the more you are going to crave exciting things like cocaine. You will pick a fight for no good reason other than to have a good fight, so you get a surge of norepinephrine and dopamine. You will jump out of a perfectly good airplane to go skydiving or bungee jumping because you need a surge of norepinephrine and dopamine. Does that make sense? So rather than have to go through all that trauma, let's just fix the problem right up front. So again, a patient who comes in with everything low, there's a good chance that they're going to be going for things like cocaine, methamphetamine, Adderall. Or if everything is high, which we often see, these guys are just like on fire. They look like a deer in the headlights, they're running all over the place. And these guys are going to need alcohol, benzos, or opioids to kind of calm things down. Does that make sense? All right. Now, we're seeing more and more neuroimaging coming. Soon, in 10 years, I hope that it will be malpractice that we don't do imaging on everybody in psychiatry. We're the only specialty that doesn't image the very organ that we treat. Neurology uses it for more of, or CTs or MRIs, and they do SPECTAs in every major hospital, but they mainly use it just for Alzheimer's or trauma. Eamon took it one step further, saying, what does depression look like? What does anxiety look like? What does attention deficit look like? Now, this is the inflamed brain. I started just kind of getting popular, and then people were bringing me their kids, 12, 13, 14, and they would come in, kids with Asperger's or autism, or if they have a terrible diet. We had one girl come in, she was bouncing off the walls. She was in a Catholic school doing handstands in her office with her skirt inappropriately exposing her bloomers, and her staple diet, if there's any nutritionist in the room, was Mars bars, Mountain Dew, and Frito chips, all of which she had allergies to. So once we cleaned up the diet, guess what? She didn't have bipolar or ADD, she had food sensitivities. And so if you correct underlying inflammation, now, if I wasn't on top of my game, I could have just given the kid Adderall, which would have just made, this thing worse, right? So it's very important to find what we say in medicine as what is the root cause that is driving the imbalance in the neurotransmitters. Now, the important thing that I've learned in the last 10 years of doing that is that I can fix your neurotransmitters. I can balance those out pretty well. I started to get good at hormones because I worked at the VA, and guys would come up to me all the time, hey, Dr. Stuller, could you check my testosterone? I'd say, okay, I'll check your testosterone. But then I found out that if we depleted or gave back their testosterone, it actually improved their mood without using an antidepressant. So I learned that hormone replacement alone sometimes works as very nicely as an antidepressant. Same thing with perimenopausal women. If you get them in balance, you don't necessarily need to be giving them an antidepressant. They're just out of hormone balance. But I learned finally that if they have an immunological problem or inflammation from food, from mold exposure, from carbon monoxide poisoning, from a bacterial infection, from a fungal infection, from a candidial overgrowth, and all these levels go up, I could throw the kitchen sink at you with all of our tricks in psychiatry, with all of our medications, and I may not ever be able to get you in control until we identify root cause for inflammation. And so it makes us really chase down what is driving this abnormal pattern. Now, this is a 12-year-old who had food sensitivities, similar to this little girl. This little guy was charming. He could be the next president of the United States, just funny and witty and lovely, super duper hyper, terrible diet, already has a little gut. For pediatricians right now, we're seeing literally, pre-diabetes at age 10 now, or HbA1cs that are 7, 8, 9 in these little people, and it's quite frightening to us as practitioners. So looking at these, see how high his histamine is here? So this tells me right away that he's going to probably have an underlying inflammation, especially since glutamate, glycine are up, and GABA was probably high, but now it's falling off the wagon because it can't keep up anymore. Now, here's another patient. This is a 44-year-old white male divorced medical researcher. He came to me with alcohol dependence, porn addiction, anxiety, depression, insomnia. He was having sleep issues. He wasn't producing well at work, on and off smoker. He was redoing a home, an old home, which was from the, I don't know, the 1600s. It was like something in the Virginia area, full of mold. And this happened to coincide with the time that he decompensated at work and that his marital problems were at its worst. He also had sensitivity to preserved and processed foods. He had a gluten sensitivity, family history of depression, and he got caught viewing child pornography at work, which was a big no-no where he worked. And as a result, he lost his job. Now he's charged with a felony, and he's still eating bad food. He also had a history of amphetamine abuse, and at the time he was doing just some Lexapro. So we did some adrenal and neurotransmitter testing. We did some brain imaging, some serum lab testing. One of the most important helpful things that I do with the medical residents is I need to know what your vitamin D level is. Low vitamin D makes you, almost anyone north of Atlanta, very seldom do I see normal vitamin D levels unless someone's on supplementation, because we just don't get enough light up here during the year. So low vitamin D can make you susceptible for seasonal affective disorder. Sometimes you will have suboptimal thyroid function because you need normal vitamin D to make your thyroid work right. And a lot of people will overeat when your thyroid's out of balance. Vitamin D controls the fat hormone leptin and satiety, which is fullness. So if your vitamin D is not up to snuff, you can also be having some eating or anxiety eating going on. We also look at your thyroid and not just a TSH. We do a full panel to be sure that you're converting your thyroid into your active thyroid. I routinely do Lyme Western blot because most of the time, by the time people have come to me, they've failed a few other practitioners, and we are in a Lyme endemic area. You can get bit by a tick. You may or may not have a rash, and the deer tick is the size of a period at the end of a sentence. So there's a good chance you may not know if you've even been bit. But it's very important that we investigate this. Also, a good clinical history is very, very important. I had one patient who was having sleep difficulties, and I said, well, do you have a cat or a dog? And because those guys can be disruptive to sleep. No. Do you have a TV in your room? No. And I said, you sure there's no animals? No. He goes, well, I have a raccoon. I said, well, I'm from Louisiana. Raccoons are nocturnal, right? So he goes, I know. Well, we brought it in. It lives in the bedroom. It's a female. The male raccoons try to get in at night. And now the raccoon's eating cat food in the house, and it's got an adrenal issue, which is interesting because the the raccoon's losing its hair because its sleep-wake cycle is all set. So I not only had to fix the patient, I had to call an alternative vet and straighten out the raccoon's food and sleep-wake cycle. I mean, it's, I guess it's tried to do too much sometimes. But if I can't get the raccoon sleeping, I certainly can't get them sleeping. So you got to work with what you get and go from there. Now, when we look at your cortisol, and this is a lot about sleep-wake, you should have high cortisol or energy in the morning, and as your day progresses, you should be ready to go to bed at 8. Do you see how this guy, anytime your numbers are below these two lines, you're going to look like you're dragging, right? That you just can't get rolling in the morning. If your numbers are up here, it will look like anxiety, racing thoughts, difficulty falling asleep. So this guy obviously is not a morning person. He's just getting rolling around 8:30 p.m. Okay? Now he's the father of 2 kids, so he's got to be up and running early. Now look at his neurotransmitters here. Do you see that he has low serotonin? And remember, he was on Lexapro, so that means that without the Lexapro, he'd probably really be in the tank on his serotonin. Now he's not turning it over too quickly, so this is not an enzyme problem. He's low in GABA. Do you remember I mentioned that he's a drinker? Okay, so he's trying to get his GABA. Taurine is okay. Again, people with low taurine often have AFib or atrial flutter or arrhythmias. Glycine is okay. Histamine, I actually worry if histamine's over 20. So even though it's looking normal here, with elevated glutamate and this histamine, remember this is the guy who was tearing out his moldy basement. His phenylethylamine is okay. Look how high his dopamine is. So this guy had a little bit of an edge to him as well. His dopac is okay, so it's not that he's turning over his dopamine. And a quick aside real quick, I'm sure friends have told you that some people get paranoid really quickly on pot, and some people, they could smoke a whole gram of pot and they don't get paranoid. If you have a lazy MAO enzyme, so let's say this number was really low, it means you can't turn over dopamine as quickly. You're more likely to get paranoid than someone who has a fast turner over. So often I ask that, I say, have you gotten paranoid when you do pot? If you do ecstasy, did you have a good trip or a bad trip? Ecstasy is a serotonergic drug. So if they had a good trip on ecstasy, often they're serotonin deficient. That gives me a clue. If they had a bad trip on serotonin, they'll probably have excessive serotonin, and that's going to influence my decision making. Here, his norepinephrine is really, really high. You see that? So again, he's got that edginess, agitation, and he's got low GABA. Do you think he's going to want to drink? Yeah, okay. And sure enough, so the low serotonin correlates with depression, anxiety, sleep disruption. His GABA is going to correlate with his anxiety, his alcohol cravings, his sleep disruption. Glutamate is going to cause him to be anxious, irritable, also insomnia. Dopamine, again, anxiety, irritability, sometimes psychosis. Norepinephrine also can indicate that you've got adrenal stress and depression. Now, remember that he had a gluten sensitivity. When you get these gliadin antibodies, watch what happens. Once you block that pathway, now glutamate goes up and GABA goes down. Does that make sense? So now this is how food inflammation can drive you to be anxious or irritable. There's a wonderful book by Dr. Doris Rapp, R-A-P-P, M.D., and it's called Is This Your Child? And it has pictures, but it's a wonderful illustration. If you're just getting into nutrition, it's wonderful to understand how food can affect behavior, not only in that moment, but within 24 to 72 hours. Now, when we scanned his brain, there wasn't a lot going on here. He had, at baseline, do you see this area is going to be depression? The cerebellum is at the bottom of the brain. Of interest, we take a picture of your brain at rest and then when you're taking a test, because your brain can look one way when you're hanging out, and then if you're either up-regulate or down-regulate, depending on what's going on. So here, it's a little hard to see, but he's got overactive basal ganglia. The basal ganglia is where anxiety lives in your brain. If you light up on the left side of the brain, the left basal ganglia, left side of the brain controls language, you will be verbally anxious, bitchy, snippy, snipey. Right-sided basal ganglia, you're more likely to internalize your anxiety, self-mutilate, commit suicide. You're going to internally direct, beat yourself up, so to speak. He also has this thalamic depression. So the limbic thalamic area is where depression lives. And so when we see overactivity in this area as compared to a normal scan, we know that you're likely going to endorse symptoms of depression. Look here in his brain. If anyone wants to know why he was doing child porn, do you think he has good braking systems up here? This is going to make him more impulsive, right? Okay. Now, he's over the age of 30-something, but you can see this could be a pre-existing trauma, but he does not have a lot of good blood flow to his brain, which is going to make him more impulsive or to have less executive judgment, like doing porn at work and getting caught. Does that make sense? Here, he also has temporal lobe problems. See these little dings down here? Now, this is an interesting point. Always, and you can tell your daughters this, before you marry a guy, be sure you look at all the suture lines in his head. You can learn a lot of information. Most men are right-handed, so if I clock you in your left temporal lobe, Left temporal injury patients usually have a temper, or if you provoke them, they're usually going to act out. If you get hit by a southpaw or a left-hand guy and he gets you in your right temporal lobe injuries, those patients tend to socially isolate more. Isn't that interesting? Recently, we had a doctor down in Kentucky, I believe it was. He's a neurological radiologist, and he tripped on the cords going out of the scan room and hit his parietal lobe, and now he cannot distinguish different shades of gray. So if you're a radiologist, you live on distinguishing different shades of gray. There was another patient that had a stroke, and for musicians in the audience, this guy loved music, and he loved music appreciation, but after the stroke, he could not enjoy music anymore. It was just as if you hear a piece of music, or like if when you feel down and you hear a piece of music, it just doesn't do anything for you. Or if you're in the 600th Catholic Mass, the music's not moving you as usual. So at any rate, where an injury occurs is very important to us. And often people they don't remember. I had a kid, I said, have you ever been knocked out cold? No. Have you been stunned or fallen off a piece of playground equipment? Did your brother hit you over the head? No, 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 no. And finally I said, well, are you sure you didn't have a car accident? He said, oh yeah. I had one where it wasn't really an accident, but I missed a turn, overshot it, ran into a canal, and almost drowned. And I starred the windshield. They had to drag me out and resuscitate me on the side of the bank. So I said, you don't think that counts as a head injury? So again, the kids' heads look like this, so of course he may not remember, and he may not really think that that was such a big deal, right? So it's very important that you wear your seatbelt. You only have one head. Of interest, I hate watching America's Funniest Videos, but I can't help it. It is amusing on some level. I just saw the new MTV version of this 2 nights ago called Ridiculousness. Has anyone seen that yet? Mm-hmm. It's like America's Funniest Videos on steroids. I mean, the head trauma is just pretty amazing. So what we did with this guy is we gave him some phenobute. Phenobute is a GABA molecule. Remember, your brain is a big blob of fat. The blood-brain barrier is a fat barrier. So if you're a drug dealer or a pharmaceutical company and you want to get a drug to the brain, it has to disguise itself as a fat to get across the blood-brain barrier, which means that you have to methylate it, esterify it, or add a phenyl group to it. And then it can cross the brain and go sit on the basal ganglia. So phenobute, also known as cabanase, works very nicely at going across the brain and having a nice calming effect on the basal ganglia. We gave him some 5-HTP, which is the precursor to serotonin. L-tyrosine is the precursor to norepinephrine and dopamine to help his prefrontal cortex. Some rhodiola rosea, which helps to reboot your adrenals, basically. It's also very important when you're buying supplements that you know exactly where that supplement's coming from and is it batch checked. For example, you can go to lesser stores and they might say, oh, we got rhodiola in it, but it's less than 2%, which means that it'd be like if you were buying wine, you might be getting Boone's Farm wine instead of a Pinot Noir with a really rich content. So you always want to know where your supplements are coming from. Also, omega-3s are so important for your brains. Everyone in the room should probably be on omega-3s. I see so much improvement in brains that are on omega-3, and it cuts down on inflammation. Multivitamin, vitamin D repletion. We had to add a little bit of Vyvanse just because the holes in his prefrontal cortex were so big. I had to use it as a protective mechanism so that he didn't relapse on the porn. Now, he did quite well on this regimen. He was able to go back to work. He regained joint visitation. He's actually remarried since then, is doing well. He's stopped drinking. He's exercising, sleeping better. And we call it alcohol dependence and early remission, meaning that he is maintaining his abstinence. So we're very pleased with that progress. What the future looks like is going to be that you would come to my office, and really we're doing all of this right now. Here the brain is on, this is a quantitative EEG, so when people come in for SPECT, they can actually get a SPECT scan and a quantitative EEG at the same time, so if you want to do neurobiofeedback later, you can do this. They're now taking combinations of imaging. So this is like a SPECT, they'll take a functional MRI, and they fuse these images. And recently a radiologist did a tilt on a 45-degree angle. This almost looks like sci-fi, but soon you'll be able to look at the brain in these multi-axial slices and see areas of high or low activity. We also do genetic testing, because I can take, again, a simple oral swab or some saliva and tell you where you tend to store your dopamine. We see if you have a methylating issue, because you can't get I could give you some Volta or supplements, but you can't get it to the brain because you don't make enough methyl groups to kind of move things through, or you may be at risk for a coronary artery disease if you have methylating issues. These tests also tell us if you're a rapid or a slow metabolizer. When I worked in the VA methadone clinic, one guy was on 300 of methadone, and the attending was like, well, this is ridiculous. This guy, all the receptors should be covered at 300. For those of you that are not familiar with methadone, probably the average methadone dose could be somewhere between 30 and 80 maybe on average, maybe higher in Baltimore. So 300 is like really, really high. But when we did actual methadone levels on the guy, he was barely therapeutic at 300. So he's likely a rapid metabolizer. So sometimes patients, we give up on the medication too soon. Oh, my antidepressant's not working, or these supplements aren't working. And it's because your liver is very efficient and you're eating it up too quickly, and you do need higher doses. Some people get a headache on one aspirin. They get toxic on everything. And it may be that they're a slow metabolizer, which means that everything gets backed up in the system and you're going to have more side effects quickly. Does that make sense? Okay. So this is what the future looks like. It's happening now. In medicine, we have a saying that whoever has the most experience wins. So I often wish that I could take someone like Dr. Ross and just download his information into my brain and his patient database on what he has seen, smelt, heard, seen, listened to. There's also that saying, whoever has the most toys wins. So he might be winning in both categories. Ross certainly has a lot of good toys here. So, any questions? Okay.
How long has this test been available?
Where's Larry? I think neuroscience has been around for many, many years now. I don't know.
They've been doing it for about 15 years.
About 15 years.
I
Yeah.
know
This exact that you do.
Yes. Yeah.
And how about the validity of the test?
I can give you volumes and volumes of research papers showing you validity, reproducibility, testing results. Of interest, when I first started working for neuroscience, I flew up to neuroscience because I went to medical school in the Caribbean, and so I wanted to be sure there was a medical school in the Caribbean. There was a rumor that after your first 2 years, they'd kill you and then bring you back as a cadaver for your third year. So be sure that wasn't the case. So I flew down there and saw the place, and I had flown up to neuroscience. Neuroscience looks like a James Bond place. It's kind of this benign-looking building out in Osceola, Wisconsin. And then you go inside and down, and there are it looks like the Batcave. Millions of dollars worth of very sophisticated immunological equipment, really top-notch testing, and very, very many smart people under one roof.
Let's get to the word about the testing.
Yes, go ahead.
Yeah. Just to answer your question on the testing, Dr. Garfield Kellerman is a biochemist and a biophysicist and geneticist, and he's been actually doing this for the past 30 years. Interesting enough, neurotransmitter testing is not new. It actually started in the 50s, and it's been pretty much relegated to academia and pharmaceutical research because the methodology to extract the information is very expensive. He was able to come up with a ELISA small molecule methodology that significantly brought the cost down to make it commercially viable for insurance coverage as well as for patients paying out of pocket. So the testing is, in the range of, $200 to $300, and it's covered by Medicare, TRICARE, and all the PPOs.
Thank you.
So Doug Bueller, by the way, did in 1951 discovered pheochromocytoma, which is an adrenal tumor, by looking at all these urinary catecholamines, so your norepinephrine, epinephrine being dumped into the urine. Of interest, the Egyptians actually were onto this a long time ago. The Egyptians first discovered diabetes because the ants were going to the sugar urine, because people were spilling sugar in the urine, and they noticed, I wonder why the ants keep trying to drink this urine. Then when they tasted it, they realized it was sweet because you were spilling sugar out. So so this has been around a long time, but it's gaining more popularity and applicability.
When you have a new patient, do you start off looking at their nutrition and diet first,
Yes.
and then you correct that, and then if that not working, you go to supplements next?
Yes, that's my usual. Usually I get a good clinical history. I like to do the neurotransmitter testing to see how high that histamine level is and what the pattern is. The more I do this, the more excellent we get on figuring out what patterns may likely contribute to what area. If the kid has elevated, just like that hot brain, the first thing I'm going to do is try to straighten out their diet. And then if the symptoms are persistent, we don't need to scan everybody's brain. Usually we scan people's brains that have had multiple treatment failures, they've been on every medication in the book, and they're still not getting better. Then we go in and take a look. Or if there's evidence of a trauma, for sure.
So if you try the diet and you go on supplements and you still have a problem, then you would go to medication.
This guy say a word about that?
Sure.
Yeah, it's an excellent question. This is actually a picture of the diet. The neurotransmitters are amino acids that actually comes from the diet. So when you're under chronic stress and poor diet, it shows up here as deficits in those neurotransmitters. And the supplementation is actually a concentrated replenishment of those amino acids. If your serotonin is in the tank, you would have to eat a boatload of turkey to get enough L-tryptophan to be converted into serotonin. And this is a nice comparison to pharmaceuticals. Pharmaceuticals act at the receptors. They either upregulate, downregulate, or block receptors. Supplements actually replenish what the precursors and replenish the actual amino acid. So that's the difference between supplements and pharmaceuticals. So when you see supplements, think diet, think food, because when you're so depleted, you have to get some significant concentration, whether it's vitamin D, omega-3, etc., to rebuild, because you could not eat enough to get you back where you need to be on baseline.
I believe that all the problems we have with teenagers nowadays are diet. I mean,
Well, no question.
Bloomberg, he wants to do away with a big 20-ounce.
And think about this, guess what's happening in the inner cities? The staple diet is often milk and cereal. So many of my patients would probably die if they didn't have milk and cereal. And for people with gluten and dairy sensitivities, do you think that, that this is helping the problem? No wonder they get hot brains and then they go out and want to use something to cool it off.
And people with good diet, for instance, if you're an addiction in that realm, or know somebody who has, one of the first things to go is their diet. Although they got great access to great food and whole foods, they actually start developing absorption problems. So they may be eating extremely well, but if you're not absorbing it, and these are tools just to give the practitioner an upfront snapshot so they know where to go and how to guide you. And you should know I'm Dr. Stuller's publicist.
There is my
She
age.
pays me after every talk, so it's a little biased.
Yes,
What is the turnaround time for the results of the test?
2 weeks, 3 weeks max usually. Yes, ma'am.
Would this test give you valuable information for people who are addicted to hoarding or shopping?
Yes. If you have low serotonin, you will hoard and shop compulsively and do other things compulsively. But hoarding and, in particular, hoarding and a lot of OCD behavior is lack of serotonin. So,
What about people who have fits of rage?
again, too much serotonin a lot of times. And that's why I ask people if they have good trips or bad trips on ecstasy, for example, because that gives me a clue if serotonin's up.
Can I ask a question? You know, there's sort of a plague of sleeping pill requests.
Yep.
Our office, it's interesting, every Monday or Friday, everyone decides that, you know, and no matter what we're learning in the press, or from studies about the dangers to people's health of using them, it's not getting through because the immediacy of using those pills to help with sleep is, I guess, very seductive. And so, I don't know if you could speak to that, because many of these people are over 50.
Yep.
And they're not abusing drugs very much, as far as I can tell. But there are many of them are still packing in those sleeping pills.
So first, you gotta get rid of the raccoon. Okay, that's first. Then we look at things that help sleep. Serotonin actually helps sleep. Okay, yes, thank you. So serotonin helps with sleep. Cavanase PM, so this is GABA with taurine, which is calming, and it's phenylated so it can get to the brain. And we also look at people's melatonin levels with the neurosleep test because, like, I have normal levels of melatonin, and if I take over-the-counter melatonin, I feel hungover the next day. I feel like I took a Benadryl. But if someone has low levels of melatonin, then the Cavanase PM with melatonin is very, very helpful. Melatonin is a hormone, so you don't want to just be throwing stuff on your hormone. These are some samples and brochures out front. This is our kind of equivalent of Ambien or Lunesta, but it's all natural. And it's basically just GABA, taurine, those are amino acids with a little bit of melatonin in it. So you can try 1 to 2 at bedtime and see if it helps.
What are your testing help with indicating the beginning Alzheimer's?
Yes, on the SPECT imaging, we can determine Alzheimer's changes 10 years before you're going to get symptomatic. And that's really important. I had a 71-year-old lady yesterday who was very pleasantly demented. And she has it looks like someone took a sledgehammer to the front of her brain and she's got these 2 big holes. She's never been a drinker or a smoker, but she was in an accident in which her car got a double hit, where she got hit from behind and then it got slammed into an embankment. And so this was a trauma-related dementia. If you have on the scan, we can't date the time of the trauma, but I mean, this was the only real significant accident she could remember, and it was a significant hit to the prefrontal cortex. But she'd never had ADD as a younger woman. She was an AD student through college. So this is likely a trauma-induced dementia. And we often use hyperbaric oxygen therapy treatment in addition to high-dose DHA. They're even doing now for the football protocols, they're using IV DHA. So remember, your brain is a big blob of fat. When you take omega-3s, those are long-chain fatty acids. So it takes fat to make fat. You also myelinate. Martech is a company that makes Life's DHA, which is the first algae-based DHA. Of interest, Martech and NASA had a contract. So if we were going to send men to space, we had to keep them cognitively sharp. We didn't want to send all these mackerels to space. So they grew algae and extracted the DHA. As a result, there's no chance of mercury poisoning, no impurities. And now most women, it's called Nevo DHA, where you're getting your prenatal, methylated prenatal vitamins, so we can get them to the brain with DHA. And the mothers who were on that formula during pregnancy and children usually have higher, at least a 2% higher IQ, faster eye-hand coordination, because your whole system's myelinated. So.
Now, may I ask if people have a genetic problem, we call it a single nucleotide polymorphism, do they handle the methylated vitamins and other products as well?
I look at during my routine testing, we also look at something called the MTHFR gene. We call it the mother effer gene, just so we can remember all the letters. We have mnemonics in medicine. And if you have a single, it's called a heterozygous or a homozygous hit, then it would mean that you may have methylating deficiencies. So if you give someone something methylated, they may have some side effect issues from it. But generally, people that have methylating deficiencies, we can identify that and correct it quickly. And most people feel a definite improvement when they're on a methylated medication.
Yeah.
Which supplements need the methylated to get into the brain?
In this particular thing, the MTHF is important for the conversion of inactive folate into folate. Now, if you can't do that, sometimes you can't get your neurotransmitters to be made. Also, you block homocysteine's conversion into methionine, and you get an increase in homocysteine. So you guys don't know this, but Dr. Ross and I are usually checking homocysteine levels on our patients, because if you have elevated homocysteine levels, you may have a methylating deficiency, but also you're going to be at risk for coronary artery disease. So you can beat your family curse. If you've had people drop dead of heart attacks in your family, you definitely want to just take a look at that MTHFR gene to be sure that it's not a player in your medical history.
How
how does this program relate to people with insensitive? Now, I know that probably the test will be shown accurate, but the medications that you get or the natural products.
Yep.
How can sensitive respond?
The beautiful thing, she's asking about chemical sensitivity to medications or supplements. There's lots of side effects with traditional medications, pharmaceutical medications. Supplements are natural amino acids. They already live in your body, but you may just be depleted. Just like water lives in our body, but if it's summertime or we're running a marathon, our levels are low, and we need to replete or give back more water. Or it could be that your GABA is low, you need some more GABA. It's like filling up the tank. Does that make sense? And usually there's less, I don't think I've seen any sensitivities on supplements. Most people tolerate them quite well. Other than they might get a little sleepier, or what have you had?
I've definitely had people, the MCS people are really unique. So they'll have,
What's
you have
the
to start
MCS
with
people?
multiple chemical sensitivity.
Yes,
And
multiple
so
chemical
sometimes you have
sensitivity.
to titrate them very, like I'll take a capsule.
Stand up and introduce yourself.
I'm sorry. My name's Iris Davis. I'm part of her fan club that she carries with her. I'm a physician in Johnson. And, but they have to be titrated. You know, just like we do with penicillin sensitivity. You sometimes have to titrate people. Because, you know, that's part of their issue. But they're usually off. Their baseline is off.
Yep.
And there's, you know, there's this incredible relationship between neurotransmitter imbalances and inflammatory bowel and irritable bowel syndrome, because there are a huge number of neurons in the bowel. I think as many as in the spinal cord.
Also, like 70% of your serotonin receptors are in your gut. So that's why people get nauseous on antidepressants.
So a lot of chemical sensitivity is the ability to modulate environmental stressors. And when you lose that, you have an exaggerated response, but you can rebuild it by optimizing your gut health, and you can do that to a large degree by optimizing the neurotransmitters, by reducing your exposure to immune perturbators. Like you could say that you're not truly allergic to wheat, but what happens with wheat for some people is it causes an immunologic perturbation, an upset. And that upset then kind of, if it happens enough or from a strong enough factor, has this feed-forward cycle that's perpetuated. So by removing the things that are perturbators, the most common ones are, you know, dairy and wheat, but there are about 10 main foods. Through an elimination diet, you can often experience an improvement in your health and a diminution in your sensitivity to the chemical stimuli in your environment. There's this sense of, you know, I'm chemically sensitive, so I have to watch out, but there's not enough sense of the need to actually rebuild, let's say, the reciprocal balancing mechanisms in your body, because these things in the environment aren't going away, and you can't live in a bubble, as many of you well know. But you can minimize the adverse effect by creating a better autonomic nervous system balance.
I do believe in that. I think we are influenced by many, many environmental factors. I just recently had a Lyme patient that I'm working with who is the most chemically and environmentally sensitive kid I've ever seen. And he is a pre-med junior and incapacitated with the Lyme disease, but he can't, when he comes into my office, I have to turn out the lights, I have to turn off my cell phone, I have to turn off my computer, I have to turn off my fish tank. I have to shut the blinds. And it's very difficult for him just to tolerate being in another place. And recently we found a practitioner through him who does work with this sensitivity or desensitization training. I don't know what it is yet or how it works, but I'm looking into that right now.
Can you let us know?
Absolutely. Just connect with me after and I'll get your card and I'll let you know.
And the other question was, you know, it's very hard for us to get to doctors' offices, and Dr. Ross is phenomenal in having an unscented staff. And the other question was, do you have an unscented office?
As far as I know, I do. We're not talking about Theo. We're just talking about
I was kidding.
Yeah. No, I don't. I don't use any. Not that I know of. I don't use anything that I can think of that would be odiferous, so to speak.
Okay.
I really would encourage people to go downstairs to the physical therapy. If you want to keep listening to Dr. Stuller, fine. She's strong. She can stand here for a while. But for those who would like to look around and see what we did down there, please feel free.
All right.